Mr. Chairman, let's call this hearing what it is, an opportunity for committee Republicans to criticize the work of the Centers for Disease Control and Prevention during the COVID-19 pandemic without them being here. CDC Director Walensky testified before this subcommittee in February, along with leaders of the other key public health agencies. She then testified before the Health Subcommittee last month. And while I appreciate the witnesses for being here and look forward to their testimony, if Republicans were really interested in conducting oversight of the CDC, they would have invited the CDC to be here today. Now, the COVID-19 pandemic was an unprecedented challenge for the nation. From the outset, there was uncertainty and confusion and a total lack of leadership. If we're going to take a look back, let's start by going back to the beginning of the pandemic and looking right at the top, then President Donald Trump. We all remember him repeatedly casting doubt about the dangers of COVID-19 right from the start. In January of 2020, Trump said that it was, quote, one person coming in from China, and we have it under control. It's going to be just fine. He praised the efforts of the Chinese government, saying, quote, it will all work out well. In particular, on behalf of the American people, I want to thank President Xi. At the end of February 2020, he said that cases would, quote, be down to close to zero. And that, quote, one day, it's like a miracle. It will all disappear, like magic. He publicly promoted hydroxychloroquine as a treatment. I remember that. Maybe the Republicans have forgotten that one. He asked whether disinfectant could be injected. He pondered whether UV light inside the body would cure people. Then in June, when the virus was killing hundreds of people every day, he said, and I quote, it's fading away and the numbers are starting to get very good. He admitted, and that he quoted again, said to my people, slow the testing down, please, slow the testing down. Now, that's just a small sample of the anti-science misinformation that President Trump spread during the first years of the pandemic. This misinformation seriously undercut our public health institutions, including the CDC, who were doing difficult work under impossible circumstances with President Trump. And certainly there are lessons to be learned, and CDC has acknowledged a need for reforms. It's implementing over 100 recommendations that were developed based on the feedback of hundreds of CDC staffers, and is also recognizing to be more efficient and responsive when facing future threats. Last month, the Director Walensky further detailed the CDC's plans during her appearance before the Health Subcommittee. She said the agency is moving forward initiatives aims to, quote, eliminate bureaucratic reporting layers, break down silos in the agency, promote foundational public health capabilities, and improve accountability at CDC. And we certainly look forward to hearing more from CDC as it continues that process. Now, the committee, I have to say, is also in the process of reauthorizing the Pandemic and All Hazards Preparedness Act, the first opportunity to review PAPA since COVID-19. It's clear that CDC needs additional authorities, including Public Health Data Authority, to be better prepared for the future. We also need to strengthen our drug and medical device supply chains, which have known vulnerabilities that would be exacerbated by another pandemic. But unfortunately, it seems the Republican majority is not interested in these approaches to better prepare for the next pandemic, but instead is focused on tearing down public health institutions. And that's extremely disappointing. We should be working together to strengthen our nation's health agencies for the future and enable them to institute reforms that will improve future pandemic response. So I'm hoping we will be able to do that in the future. But it's clear that that's not the Republicans' goal right now. So I don't know what else to say. I mean, I certainly want to hear from this panel, but the CDC should be here. And the idea that that there were problems with the CDC, you know, just go back and look at what your president was doing that first year. I mean, I was listening to all this nonsense while he was president and supposedly dealing with this crisis, and all he did was make things worse. And I think a lot of people died, and because of the fact that he misinformed everybody about what was going on. So with that, yeah, sure.
Thank you for yielding. I just want to also add the lack of cohesive leadership from the top, from the White House, added to pre-existing issues at the CDC that were long-standing. And this committee, in a bipartisan way, has explored those for many years. and that led to the chaos. So we do need to move forward, but blaming it on the current CDC is just wrong. Thank you, Mr. Ranking Member, and I yield back.